I'm an organ recovery coordinator for LifeShare. So what we do is we go in and we manage the patient, the donor, and help to optimize the function of their organs to help maximize the donor's gift for all of the recipients. So I'm a registered nurse, and I actually spent 15 years at the bedside, and most of that in the ICU. And then an opening came at LifeShare, and so you're still at the bedside managing a patient, but you actually have a little more autonomy and responsibility. To be an organ recovery coordinator, they require either a nurse, paramedic, or respiratory therapist, and it can be an RN or LPN. They do prefer for you to have quite a few years of experience. To be an organ recovery coordinator, again, you need to be either a nurse, paramedic, or a respiratory therapist. I can only speak for myself, but pay attention in your anatomy and physiology classes. Your pathophys is going to be your ground that you will build upon. Go in the hospital and try to get as much knowledge as possible. You really need the ICU experience, managing those critical drips, and just always find new and interesting ways to keep your field just interesting. ORC, we work 12-hour shifts. We go to hospitals. We cover all of the state of Oklahoma, and so we could be going to Tulsa, Durant, next day Oklahoma City. So we go everywhere. We manage the patient, and that's anything from checking their lab work and making changes, changing ventilator settings, titrating critical vasopressor drips in order to see what the baseline function of a heart is. Then we also are the ones who, what we call, run our list in order to find the recipients for each specific organ, and coordinate with all those other transplant centers to find the matches and help set up the OR time for all the different teams to meet at the hospital. It's really hard to kind of go to work and you're dealing with death day in and day out, and having to see the families and see their grief, and knowing that they're about to lose one of their loved ones, it can kind of wear heavily on your heart. The most rewarding part for my job is just knowing that what I'm doing on the front side is going to really impact and help someone else live a longer and healthier life. But also, I've had many families say that this is the only good thing that could come out of losing their loved one. And so it does help heal, I think, sometimes the donor's family as well. We have two routes of death. So there's brain death, and then there's also donation after cardiopulmonary death. So for brain dead donors, we can have babies up to 11 pounds all the way to, I believe it's age 100. I know the donation after cardiopulmonary death, it's also babies 11 pounds and all the way up to, I believe it's age 75. Some cancers may rule out you being able to be a donor, specifically probably the most wide-known one is breast cancer. And then if you've had certain cancers within the past 5 years, that could also make you ineligible to be a organ donor.
Yeah, so whenever I got into LifeShare, I thought, well, HIV patients can't be donors, or Hep C patients can't be donors, and that's not the case. Active cancer and COVID are the only rule-outs for a donation. Someone who is, say, HIV positive, they can either donate to someone who is also HIV positive, or they can donate to someone who is really in desperate need of an organ, and they'll start treating HIV or Hep C at the time of donation. So it's the lesser of two evils to get the organ that and potentially have that infection and fight that infection medically, because then it can still extend your life. Also, if you get an organ that's maybe not the best, someone who's really, really sick will take an organ that's not fantastic, and it will keep them alive for a couple of years until they can get a better organ and have a second transplant. And that can extend their lives even better. So the criteria to be a donor is really quite broad.